DNAdose has collated all the data from nearly all the patients that I've done this on to date, and I think the red ones are the ones where they're showing a significant metabolic profile that would change the way I practice. So I think they've collated the data. So 76% of the people that I've done the test on have a major finding, 19% a minor finding, and only 5% are normal. So I think what this is telling me is that I'm doing it on the right patients. I tend to only order a tester for changes to management. So I've heard that the most expensive piece of equipment in the health budget is the intern's pen, ordering tests that sometimes aren't really needed. So I tend to only do tests that will change management. And I think if I'm using those principles of side effect profile, and then people not getting results from maximum doses, then these are the sorts of findings that are coming. So I just thought I'd do a case study. I've got this man, Mr. Smith. He's a 54-year-old man. So I won't go into too much of the psychiatric issues. I'll just give you the presentation, just tell you about a few of the medications that he's been on. So it's a 54-year-old man. He's got a history of OCD and generalised anxiety disorder. So a lot of his issues were surrounding checking, and obsessional thoughts about music and certain songs which would play over his head day after day, and compulsive behaviour to try and manage those obsessions which were distressing to him. Now when he came to see me, he was on fluoxetine 60 milligrams, and he was getting side effects from this. He was sweating, he said that he was jittery, so it can cause a bit of agitation and tremor. He said the medication was partially effective, so when I see people, I ask them if 100% you back to normal where you want to be, how close are you to that? And he said it was about 50%, so partially effective, but getting side effects on 60 milligrams. Now in the past, he'd been on citalopram, escitalopram, desvenlafaxine, duloxetine, and imipramine. And I think the imipramine sort of raised my eyebrows a bit, because that's a good medication according to some of our guidelines for treatment of OCD. So I asked him a bit more about the imipramine, and he said he only took it for one night, didn't tolerate the sedative side effect. So what I did was I weaned him off fluoxetine. I actually went back to the imipramine, and I think what I tried to do is to tell him to persevere with it. So we started off on a low dose, and I said give it a bit of time and see if we can get this into your system, and hopefully the side effects would settle down. Once again, he didn't tolerate it, so heavily sedated. I gave him Valium in the process as well, whilst we were weaning off the fluoxetine and starting the imipramine, and that was ineffective at doses of about 5 to 10 milligrams TDS PRM. And at this point, I think I was running out of options with everything else he'd been on. I wasn't sure why he wasn't tolerating these medications, so I looked towards the DNAdose. So as a psychiatrist, I've got the luxury of having a bit more time with people. So within a half-hour appointment, I can easily whip off one of these cheek swabs on a patient. It takes me about 10 minutes. And whilst I'm doing that, I can still talk to them through the DNAdose procedure. So I would often think about the DNAdose in the back of my mind, and then give the person a handout that they can take home with them to have a read through it. And then when they come back, I'm doing the DNAdose test straight away once they come in for an appointment. I think when you end up, if you order the test and got these results, there's a lot to take in. So I just sort of walk you through what the results say and then how it can dictate the treatment. So on the current medications, I wrote down what he was on, and then the clinical notes is just what he'd been on in the past. But basically, when I got the results back, what was quite striking was the 2D6, and he was a slow metaboliser, and also the 2C19, he was almost off the Richter scale in regard to being a fast metaboliser. So you get the DNAdose profile and the current medications. So they'll comment on your current medications and tell you what to expect in regard to side effect profile. depending on what medications you've got the person on, and then recommendations for therapy after that. And over the page, they divide the medications that we could use into the different enzymes, so the TD6 and the C19, and then also let you know about the metabolism, whether it's reduced or fast or normal. So I think what I took from this was that if I was going to give him medications which were metabolised by 2D6, like Effexor or Cymbalta, which have been on in the past, so it explains why he was getting increased side effects on these medications. And what I was thinking is that I would try to avoid those medications if I could, and then look towards the ones where he metabolised normally, which there weren't any from these. But the fast ones, people just need a higher dose. So I looked towards the fast, the C19, and then saw that he'd been on sertraline, citalopram before, and then I was just looking at other options there to see if we can treat. Now the interesting thing with him was the diazepam. So I put him on diazepam, which is ineffective. And this man's going to require a lot higher doses of Valium or diazepam to have the same effect due to his high metabolism of the TC19. Is it all crystal clear? Yeah. Interesting too, when you look down the test, they comment on codeine, Oxycontin and Tramadol, so a lot of our patients are on these medications as well. Warfarin, NSAIDs down the bottom, Dilantin, and over the page, propranolol, which is something else I might use for anxiety. So it gives a fairly varied idea about different medications, and I think you're adding new medications all the time, depending on what the research is coming through. So this slide just summarises Mr. Smith in regard to his 2D6. He's an intermediate metaboliser, so 80% reduction in 2D6. So increased risk of side effects from fluoxetine, duloxetine and the tricyclics, which are the medications he's been on in the past, and also what I had him on. And also with the C19 is an ultra-rapid metaboliser, 150% increase. So he'd require a higher dose of those medications to have the same effect. I was looking towards the other medications and at a higher dose, but with this man, he was quite haphazard in the way he took his medications. So he may skip 2 or 3 days, he'd take medications, and then after he would skip them, he would suffer discontinuation symptoms, which then would make the anxiety and the OCD more severe. So at the end of the day, after discussing all the options, we went back to fluoxetine. So it's a longer-acting antidepressant, carries people over for about a fortnight or so with some of the active metabolites. But the low dose, that was what we thought we'd do going on the test of the DNAdose, and try to be reluctant to increase the dose, and then look at other augmentation strategies with the fluoxetine to try and get it better.